Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating case report published in the Journal of Veterinary Internal Medicine in 2024. This research sheds light on a rare neurological sign in dogs, resting medial strabismus, also known as esotropia, and its association with a specific type of brain injury, a contralateral paramedian thalamic ischemic infarction. In human medicine, a condition termed pseudoabducens paralysis, which results in this resting inward deviation of the eye, is a known but uncommon consequence of an ischemic stroke affecting the contralateral paramedian thalamus. Pseudoabducens paralysis isn't a problem with the abducens nerve itself, which is responsible for outward eye movement. Instead, it's believed to stem from increased activity related to the inward movement of the eye. While esotropia has been documented in dogs due to issues with the abducens nerve on the same side of the body, or problems with the eye muscles themselves, its occurrence as a result of damage to the thalamus was, until this report, unconfirmed. The thalamus is a crucial part of the brain involved in relaying sensory and motor signals, as well as regulating consciousness and alertness. Researchers in the study investigated 2 canine cases that presented with this unusual eye finding alongside other neurological abnormalities. The study details 2 specific cases. The first case involved a 7-year-old male neutered border collie who was brought to the hospital for a sudden onset of non-progressive vestibular ataxia. This meant the dog had issues with balance and coordination. On examination, the veterinarians noted a distinct right head tilt, an inability to walk, and significant vestibular ataxia, causing the dog to constantly roll to its right side. Importantly, a cranial nerve assessment revealed a right esotropia, meaning the right eye was turned inward even when the dog was at rest. There was also a suspicion of difficulty in looking upwards, although the reflex that stabilizes gaze during head movement remained intact. Additionally, the dog exhibited brief, unintentional head tremors with a vertical motion. Based on these neurological signs, the problem was initially localized to the right side of the central vestibular system, with a suspicion that the thalamus was also involved. Routine blood and urine tests were largely normal, except for mildly elevated cholesterol levels and increased C-reactive protein, an indicator of inflammation. Blood pressure was within the normal range. To further investigate, the dog underwent magnetic resonance imaging, or MRI, of the brain. The MRI revealed a well-defined lesion within the left thalamus, extending towards the midline from the ventral level of the midbrain aqueduct to the ventral thalamus. The characteristics of this lesion on the MRI scans were consistent with a recent, localized ischemic stroke, specifically a lacunar infarct, in the area supplied by the caudal perforating artery. Further tests ruled out any obvious chest or abdominal abnormalities, and while blood clotting tests were generally normal, one analysis suggested increased platelet activity, potentially pointing towards a thrombotic event. The dog received supportive care in the hospital for 7 days, including intravenous fluids, anti-nausea medications, and physiotherapy. Remarkably, the dog improved significantly, regaining the ability to walk, and was discharged. The episodic head tremor completely resolved within 9 days of the initial stroke. The second case involved a 12-year-old female neutered crossbreed dog who was also presented for a sudden onset of non-progressive vestibular ataxia. Similar to the first case, this dog exhibited a marked right head tilt, an inability to walk, and significant vestibular ataxia, causing it to roll to the right. Assessment of reflexes indicated decreased use of the right front and back legs. Cranial nerve examination again revealed a right esotropia, along with a rhythmic involuntary eye movement called rotatory nystagmus, with the fast phase directed to the left. The initial neurological assessment pointed to a lesion in the right side of the central vestibular system. Routine blood and urine tests were normal, and blood pressure was within the normal range. An MRI of the brain identified a distinct lesion in the front part of the left thalamus. The imaging characteristics were consistent with a recent, localized ischemic stroke in the paramedian thalamus. Interestingly, another older lesion, consistent with a previous stroke, was also observed in the left caudate nucleus, another area of the brain. A test for antithrombin 3 activity, a natural blood thinner, was normal. This dog was hospitalized for 9 days, receiving intravenous fluids, an anti-clotting medication called clopidogrel, and physiotherapy. This dog also improved to the point of being able to walk and was discharged. The researchers discussed their findings, highlighting that these 2 cases suggest that resting medial strabismus can indeed be a rare but significant indicator of a stroke affecting the contralateral paramedian thalamus in dogs. They proposed a mechanism for this observation, drawing parallels with what is understood in humans. The theory is that the stroke in the thalamus disrupts descending inhibitory pathways. These pathways normally cross over in the subthalamic region and send signals to the motor nucleus of the oculomotor nerve on the opposite side of the brain. The oculomotor nerve is crucial for controlling several eye muscles, including the medial rectus muscle, which is responsible for turning the eye inward. When these inhibitory pathways are interrupted, it leads to increased tone, or hypertonicity, in the contralateral medial rectus muscle. This constant overactivity of the medial rectus muscle then pulls the eye inward, resulting in the observed esotropia. The study also provides important anatomical context. The oculomotor nerve originates in the rostral midbrain, with a motor nucleus controlling eye muscles and a parasympathetic nucleus involved in pupil constriction and lens accommodation. While some nerve fibers cross to the opposite side, the exact proportion in dogs isn't fully known. The extraocular muscles, including the medial, lateral, ventral, and dorsal rectus muscles, as well as the oblique muscles, control eye position and movement. Strabismus itself is defined as an abnormal eye position due to problems with these muscles, the nerves that supply them, or congenital issues. While previous reports in dogs have linked esotropia to abducens nerve problems on the same side or to muscle disorders, this study provides evidence for a connection to a thalamic lesion on the opposite side. The researchers also touched upon other neurological signs observed in these cases. The head tilt scene was consistent with reports in dogs with contralateral paramedian thalamic lesions and might be related to dysfunction in specific nuclei within the midbrain. The episodic head tremor in the first dog, which resolved with clinical improvement, is interesting as such tremors have been associated with thalamic lesions, although typically involving different specific areas. This case suggests that the paramedian thalamus might also play a role in this type of tremor. Finally, the study briefly discussed the likely cause of the thalamic stroke, suggesting thromboembolism, a blood clot blocking an artery, in the small arteries supplying this region of the brain. The approach to antithrombotic treatment differed between the two cases, reflecting the evolving understanding and guidelines for managing ischemic strokes in veterinary medicine. In conclusion, this case report highlights that resting medial strabismus, or esotropia, can be a key neurological sign pointing towards a stroke in the contralateral paramedian thalamus in dogs. This understanding is crucial for accurately diagnosing and localizing brain lesions in veterinary patients. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.